Now, the FCT administration is appealing to President Muhammadu Buhari to assent the bill for an act to establish the FCT Health Insurance Agency and the FCT Health Insurance Scheme. Director of the FCT Health Insurance Scheme, Dr. Ahmed Namfulani, made the appeal during a stakeholders engagement forum in Abuja. Correspondent Lois Abosambo has details.
The Senate, in the year 2021, passed for third reading the bill for an act to establish the FCT Health Insurance Agency, which is to give legal backing to the FCT Health Insurance Scheme. However, the bill is still awaiting the President's assent. Speaking during a stakeholders meeting, the director of the FCT Health Insurance Scheme, Dr. Ahmed Namfulani, said the FCT Health Insurance Scheme has been operational for a decade without the needed legal framework for its operations, while appealing to the President to assent the bill.
The FCT Health Insurance Bill are actually going to Mr. President on two different occasions without getting assent. So this is another opportunity for this to happen. So it's the issue with the National Assembly and bills. We have to wait until it comes. And we cannot determine whether this is where it will end. So we are still waiting.
Speaking on the National Health Insurance Act, he noted that it makes health insurance mandatory for all residents and explained that modalities are being worked upon which will compel citizens to get health insurance.
The HIA Act has actually made health insurance very mandatory. There's going to be a modality for everybody to show evidence of having a particular health insurance. If you don't do it, I don't know, they are still working on the modality now. So it's not even going to be an issue of punishment. No. For example, if you don't have your health insurance, you might not be able to open the bank account. If you don't have health insurance, your company might not be able to bid for contract. If you don't have health insurance, your ward might not be able to be enrolled into a university. So those are the mechanisms by which some of these things are going to be checked.
Lamenting the mortality rate in the country due to lack of health insurance, a health expert, Dr. Lola Mabugunje, said it is pitiful that the FCT Health Insurance Scheme is yet to be assented to.
Health insurance, for me, I look at it as something for the vulnerable, people in vulnerable situations, and is to make sure everybody has access to health. So it has to be passed. It has to be. We've reached that point to make people access health care without incurring on them any problem.
Speaking on the role of media in ensuring that universal health coverage is achieved, ACE Health journalist and executive director of the International Society of Media in Public Health, Mrs. Moji Makonjola, said the media needs to prioritize health in its messaging.
I know that the media is a strategic tool to evangelize national health insurance. Why is this important? It's important because a lot of times Nigerians don't have the out-of-pocket resources to meet their health needs. Even if they have, it's not sustainable. And if you look at the number of people that health insurance can reach at a particular time, it will help us bridge the gap that we have in healthcare treatment when you need it, where you need it, and how you need it.
The bill for an act to establish the FCT Health Insurance Agency, when assented to, will give the agency the legal backing to provide comprehensive, quality, and affordable health services for all residents of the FCT. Lois Abosambo, ASO Television News.